Hi, this is Dr. Centeno, and today we're going to talk about why a shoulder decompression surgery, otherwise known as an acromioplasty, is often a really bad idea for patients. First, let's learn about the anatomy. The AC joint is the joint between your collarbone and the back of the shoulder blade, and it's kind of right there where the arrow is up top. When it develops arthritis or is a little bit misshapen, it can sometimes place some pressure on the rotator cuff. When this doesn't get better with physical therapy, often surgical decompression is performed. That's called an acromioplasty. And this involves basically lopping out the whole joint, including a lot of important stabilizing ligaments. But is this a good idea? Well, what does the research say? Interestingly enough, it's not positive, meaning that adding an acromioplasty to a shoulder rotator cuff repair doesn't improve outcomes over not doing it. In addition to that, removing this important joint in the acromioplasty makes the forces on the rotator cuff worse. That's interesting because the whole goal of the procedure is to make them less. So let's see what really happens after the surgery by looking at a live moving x-ray of a patient who was made worse by this procedure. So first, some anatomy. That's the AC joint, and that's what an x-ray of the AC joint looks like. We've got the collarbone coming off from the right and the part of the shoulder blade that connects coming off from the left. And this is what happens after the joint is lopped off by the surgeon. Those two pieces in yellow were taken off, and we're left with this huge gap where the joint should be. Now, if we measure that gap on this live x-ray I'm going to show you, when it's down like this, you can see it fits almost 3 boxes. But when the patient raises his shoulder, it narrows to less than 2 boxes. So the joint is moving around. So let's see what that looks like in reality. So this is the moving x-ray. We can see that the joint is moving around. It's large there. We have a large gap, and then we have a small gap. Large gap, small gap. It's not supposed to do that. That's a bad thing for the shoulder because it means that all sorts of extra forces are getting placed on all sorts of other structures. So in conclusion, removing the AC joint is not a good idea. The research doesn't support that it helps. The research shows that acromioplasty can make things worse with regard to forces on the rotator cuff. You can see this with your own eyes as the shoulder becomes unstable on that live x-ray. And consider more advanced regenerative medicine solutions like precise injections of your own platelets and stem cells before you do this crazy surgery to remove a joint that can never ever be put back in. Thanks so much and have a great day.